Hello and good evening, everyone. I welcome you all to the series of webinar on behalf of Yashoda Hospitals. While some rain after a hot and humid day can be refreshing and sweet, the fact cannot be denied that it could bring in some monsoon illness as well, especially among the children who are more prone to falling ill. Well, in our today's webinar, let's discuss about dengue, especially in children, what causes it, and what are the precautionary measures one can take with our expert panelists today. I'm Dr. Lakshmi, and joining us today, we have Dr. Ramesh, Senior Consultant Pediatrician and Head of the Department, and Dr. Shrikant, Senior Consultant Pediatrician from Yashoda Hospitals, Secunderabad. Welcome, doctors.
Hi, Dr. Lakshmi. How are you?
Yeah, good. So, doctor, the monsoons are here and the monsoon-related illness are on rise, especially among the children, leading to increased hospital visits and admissions. So why do you think the season makes them more vulnerable to illness?
Normally, during the summer holidays, what happens is that all the children are well protected. They are there at home. The extreme heat in summer, generally the bacteria and viruses are totally killed because of the extreme heat in our country. And the child is not exposed to other children. In all ways, they are in a very safe environment. With the first onset of monsoon, the schools also start at the same time. Normally, it's around June 15th. That's when the monsoon starts, and the schools also, they start at the same time. So at this time, the dampness in the air, and sometimes the children getting wet, and and all that so-called slushy, that dirty, I would say all the surroundings around the school, around the house, all this leads to the so-called insect breeding. It may be flies or it may be mosquitoes. Along with that, the damp air itself, sometimes it causes some amount of colds and coughs and may lead to pneumonia also, because nowadays we have a lot of viruses, especially the swine flu viruses. And in children, about 5% of the children also, they get severe COVID sometimes. Now that's we are seeing recently. But the most important thing, which actually we are going to discuss today, is the mosquito-borne diseases. Malaria we know from a long time, and malaria can be easily controlled. But we'll mainly talk about dengue. The most important thing about dengue is dengue. All the parents, they protect the child very well in the night time against mosquitoes. They'll probably put some anti-mosquito measures, which we'll be talking at the end of the session today. What are the precautionary measures? But the mosquito which causes dengue, that is the Aedes aegypti mosquito, that is very active in the afternoon times, or sometimes even in the mornings also. And these mosquitoes, because they are active in this thing, they are generally very commonly seen in schools, and they get the children. So that's why dengue is very difficult for the child to escape, because he is in the school, which is generally very crowded, and the mosquitoes, generally they'll be there below the benches and they'll get their children on the legs. So this season, we have to be very careful with dengue, and especially the hygiene should start from schools. So the school so-called sanitization, the school hygiene standards should be very, very high.
So, doctor, discussing about dengue fever in particular, what exactly is dengue fever and what causes it? As we've already discussed that mosquito bite is the main reason, but what exactly is dengue fever and how different is it when compared to other viral illness?
Yeah, dengue is basically caused by a virus. It's like an arbovirus of the Flaviviridae group of viruses. Like, it's basically divided into 4 categories. It has like 4 serotypes, that is type 1, 2, 3, 4. So these normally cause most of the clinical illnesses or the disease which actually happens in like children. And what you should know is, like, once the mosquito bites a person, like usually, like, apart from humans, like monkeys are like one of the amplifying hosts. So once they take a bloody meal, for it to transfer into the salivary proboscis again, for it to be able to reinfect a human being, like, it takes around 3 to 7 days. So the worst part is, once it actually gets the virus inside its glands, like, it can infect any human being throughout life. Okay, so as long as it is alive, it will be transmitting the disease. Okay, so the bad thing about dengue is that's the reason why we don't have a vaccine till now. So if there is one serotype, like for example, there is DNV1, and we get that particular disease, And if there is one more serotype like DNB2, okay, so like if we get infected with DNB1, okay, there is a chance that next time if you're reinfected with like DNB2, like there'll be a very severe disease inside the human being. So that's the reason why we did not have like a quadrivalent vaccine till now. It is actually under development, and it's approved like in a few African countries between the ages of 9 to 50 years. Okay, but it has like not yet come to India. So the clinical features of dengue, like normally when the mosquito bites a human being, it probably between like before it was 5 to 7 days, now it's 2 to 7 days. Like as short as 2 days, it spreads into the blood, and then like it actually causes the illness. Okay, which includes fever, myalgias, arthralgias, headache, and also vomitings. Okay, these are like the 5 cardinal features. So any child who has like fever with vomitings as well as pain abdomen, you have to see a doctor. Do not like neglect it, thinking that it's like a simple acute viral gastritis or something. Okay, so apart from this, like dengue's clinical features are like divided into 3 phases. Like before pre-2009, from 1975 to 2009, there was something like dengue fever, dengue hemorrhagic fever, and dengue shock syndrome. That has been changed recently. So post 2009, it has been now classified as dengue with warning signs, and dengue without warning signs, and severe dengue. Okay, severe dengue is subclassified into dengue hemorrhagic fever and dengue shock. Okay, so basically it is divided into 3 phases. So once the mosquito bites and once the incubation period is finished, you have something called a febrile phase. Okay, where you get fever, high-grade fevers with chills at around probably 102 to like 103 degrees. And then that lasts typically between 3 to 7 days. Okay, so from the 3rd day of fever, we enter a phase called the critical phase. This is the most talked about phase and the most problematic phase nowadays. So once you enter into the critical phase, you'll have like a couple of things that you have to keep into mind. Okay, first one is you go into hypovolemic shock because there is something called a capillary leak syndrome. Okay, so the virus initially comes, you have something called a capillary endothelium. It just puts its spike protein in between, and it causes increased intravascular space. So there's a lot of fluid loss. So once the plasma component of the blood seeps out, automatically like the child, like a child goes into shock. Okay, so once the shock sets in, then it is again into severe dengue. Okay, then you have the critical phase normally lasts between 48 to like 72 hours. Like, so this is when the child needs to be monitored. It's like very important, like for the child to be monitored. So what happens here is there is something called platelet mimicry going on. Okay, platelet mimicry means like the spike protein, especially the non-structural one antigen, like the NS1 antigen, which is there on the dengue. It mimics exactly one of the structural proteins on the platelet. So because of this, like the antibodies which are attacking this particular virus will also start destroying our platelets. So we have a significant drop in the platelet counts. And the other thing is like you'll go into shock, which I like already mentioned to you. And the third thing is like you can go into bleeds, because like the platelets, basically what their function is they actually come and they aggregate and they like form a fibrinogen and the thrombin, which is like actually the clot. So once the clot formation is not happening, like there will be microvascular bleeds everywhere. Okay, so an intracranial bleed or like a stomach or a massive GI hemorrhage can like actually kill you. Okay, so you have to be very, very careful between 48 to like 72 hours after you like get the fever for like 3 days. And the mother should also know that once the fever is down, sometimes a lot of people will think like the problem is like finished. But no, like the problem starts after defervescence. That means after when the fever stops. Okay, so this is when you have to be most careful during dengue. And
so, doctor, you've elaborated about the clinical features such as fever and body myalgias, which is common in viral illness, especially in dengue. But I'm sure most of the parents treat the initial days of fever at home thinking that it's just like any other common viral illness. But what are the warning signs or red flag signs that the parents should worry or should look up to? And when should they seek immediate doctor consultation?
yeah, this is actually like a very interesting question. Like initially, like high-grade fever, which is not subsiding for at least 3 to 5 days, it is like persistent fever. Okay, and the next thing, the main indication of dengue is for admission, I'm like telling you, is when the child has high-grade fever, which is not subsiding for like more than 3 to 4 days, or if the child has like persistent or like significant thrombocytopenia of less than like a lakh, and also like if the child has severe pain abdomen. So one of the cardinal features of dengue is if it goes into a disseminated intravascular coagulation. So once you develop a DIC, you'll have like tender hepatomegaly. So if you're feeling that the child is getting any pain near his liver area, or if there's like severe abdominal pain, or if there's any accumulation of fluid, it's like called polycerositis. So once this starts in, like the child has to immediately see the doctor and preferably has to be inside observation inside the hospital. And the laboratory features are also very, very important. So what we do is like what happens in like dengue is like you have like a CBP count. So what is important in this particular complete blood picture is there is like a low leukocyte count, there is a low platelet count, and there is a lymphocytic predominance. Okay, and apart from this, like the LFT may show raised transaminases, which are more than 1,000 units per ml. Okay, so these are one of the cardinal features of like dengue, and the ultrasound also can easily pick it up. Especially there is something called gallbladder wall edema. Okay, so once this particular feature is there, it is always better to just come and see a doctor and then go from there.
But before that, as a old senior pediatrician, the mother, because your question was how should the mother know whether the fever is toxic or not? So normally during this season, every mother should think that any high fever, unless and until proved otherwise, it could be dengue. So dengue fever normally, once the fever is high, the child itself will have a different reddish hue over the whole body. That's called a flush. The whole body, especially the face, it will have a reddish hue. And this is called the two-finger test. Anywhere on the skin, preferably on the hand, if you press with these two fingers and take out, you'll be able to see a white the two fingers mark. That shows that the whole skin is having a flush. If this sort of thing is there, then he's a potential candidate for the dengue to become to progress into an hemorrhagic or a future shock syndrome. They should immediately go to their doctor, get the basic workup what Dr. Srikant has so beautifully elaborated till now, and get the checks done. So they should not take a chance of trying to give some paracetamol at home, because too much excess paracetamol or any NSAIDs like ibuprofen or something, they can cause more bleed inside and bring down the platelets further.
Absolutely.
There's actually even something called a positive tonic weight test, which I wanted to add. So normally you just have to tie the BP cuff around your hand. This is one of the simplest ways to determine severe dengue, and put it midway between systole and diastole, and hold it there for 5 minutes, and then take it off, and then check your antecubital fossa. So once you have small dots around here, you get petechial rashes. So just count them per square inch. If you have more than 10 dots per square inch, that's classical of capillary bleed. Okay, so I would just like to add that one extra test, which can be easily done at home as well.
Yeah, that's interesting. So once a child is diagnosed with dengue fever, what is the treatment approach like for the not so sick as well as the sick patients? Do every child diagnosed with dengue fever, do they require hospital admission?
Yeah, so basically this is also important, ma'am. You have something called NS1 antigen and IgG and IgM antibodies. Okay, so this is one of the easiest ways. So the direct way is either through viral culture, but that takes too long. And the indirect way is through the non-structural 1 antigen. So that's one of the spike protein on the dengue. So how it's actually in the first day till the 4th day, NS1 antigen has a specificity of almost 100% and a sensitivity of around 85%. Okay, so it's one of the easiest way to diagnose dengue. And the good thing about NS1 antigen is it takes a very short time to actually come back. But from the 5th day of fever onwards, you then have to go for the IgG and the IgM antibodies. So the IgM antibodies, they start at around the 4th to the 5th day, and they start increasing. They peak around the 7th to 14th day, and by around a month, they almost become 0. But the IgG antibodies start a little bit later. So they start probably at around the 7th or 8th day of fever, and sometimes persist throughout life. Okay, so this is the easiest way to diagnose dengue. And now coming to treatment, the mainstay of treatment of dengue is fluid management, nothing else. Okay, so you have to make sure that the child is well hydrated, because again, as I told you, there is a lot of plasma loss inside the body. Okay, so because there is a lot of plasma loss inside the body, you have to make sure that the fluid is again replaced. Okay, so normally if the child is not sick, then we just prefer to give ORS. But if the child is sick and requires hospitalization, we normally check. So if the child is into severe dengue, then we start off fluids at around 7 ml per kg per hour for 1 whole hour, and then reassess the packed cell volume. So what happens is, due to hemo concentration, the packed cell volume keeps increasing. So if there's an increasing trend, that's when we have to actually be worried. But once we finish the initial bolus and then come down to around 5 or 3 ml per kg per hour, and once the child is fine, that's when we can actually tell the parents that there's like nothing to like worry. But if the child is still not even like if the PCV is still maintaining at around that level, then if you increase from 7 to around 10 ml per like kg per hour, and you can go to a maximum of 15 ml per kg. Even if the child is like not responding well, then you have to shift to colloids, preferably like blood transfusion. So this is the mainstay of like treatment for patients who are admitted. But for patients who are not admitted, just fluid management, stay at home, treat the fever with like paracetamol. Do not use NSAIDs as what sir said, because they further lower the platelet counts. And you have to keep monitoring the PCV as well as the platelet counts every 2 days. If you fail to like do it, and if the child goes into hypovolemic shock, then the treatment becomes difficult.
Simple blood check. We have to also measure the blood pressure. If the blood pressure is going down, or the pulse pressure, that is the difference between the systolic and diastolic pressure. If it is getting to 20, then it's an indication that he is going to get serious. So that's the time immediately he must rush to the hospital. So if the mother is smart enough to at least monitor this sort of things at home, that is see the blood pressure and see whether the child is really sick. If you have that much confidence in the mother, I think the dengue cases, because almost 50 to 60% of the dengue cases, they self-subside and they'll be okay. So only the lesser ones require about 20 to 25% of them, they become really very serious. So you can monitor at home for the first 2-3 days.
Okay, doctor. So doctor, we've discussed about various aspects about dengue, like what causes it, its symptoms, its tests and treatment. But are there any myths which needs to be corrected or which needs to be talked about? Like we've got many questions asking us like, is dengue contagious? Does it spread from the mother to the fetus during pregnancy? And most common question is the papaya leaves, can the papaya leaves treat this disease? So what do you have to say about this?
Yeah, so it's basically like carica papaya leaf extract. Like it is known to stimulate. Like again, as I told you, this doesn't come under allopathy. This is more like Ayurveda. Okay, so it is known to stimulate the megakaryocytes to actually produce more platelets. So that is not exactly a myth, because it is not exactly clinically proven as well. So I can't really comment on that, but I have seen parents who have actually used it and who have actually had a success rate. So normally what you have to know is, because of it is basically an autoimmune process. So our own antibodies are like destroying our own platelets. So sometimes like towards the end of the disease, for example, anyway, like your platelets are actually going to improve. But like the mothers sometimes attribute it to this carica papaya leaf extract. But actually like your megakaryocytes are producing platelets, and now the destruction process also has stopped. So anyways, like your platelets will be increasing. So that could be one of the reasons. And regarding the...
Just interrupting Srikanth in this caricature business, is something like, see, for example, if a child is really very badly sick, so somebody would like to offer a prayer or tie a tayat or something like that. As long as it's not going to harm the patient in any way, sometimes it's better to allow it and continue with the treatment. So whether the tayat has helped him or our treatment has helped him, we leave it to God. So generally, once the child is not very serious and is in a position to take any of these extracts, means by then he's almost okay. So by taking that, it's not going to at least harm the patient. But whether the patient ultimately thinks it's that the leaves which is causing the problem. But when a few patients whom I have noticed, this so-called papaya leaf extracts cause severe gastritis sometimes. And with that also they can bleed and lose unnecessarily more blood. That is in about 10 or 20% of the patients. So I think as professionals, we should completely discourage that.
Yeah, I think
she wanted to know about the transmission from mother to us.
Transmission from mother to infant happens. It happens through the placenta. But the thing is, like during the 3rd trimester, if you're actually infected with dengue, it can cause very severe disease in the infants, because actually I told you, any child who's less than 2 years is prone to like severe dengue, and especially infants are very, very prone to it. And it is better if the mother like does not get the disease during the time. It's probably the worst time to actually get it. And it does transmit from the mother to the infants. And the antibodies from the mother actually reach the infant and they stay for around 6 months. So for the next 6 months, the child has protection to some extent, and beyond that, it actually weans off.
Okay. So one last question before ending this session, and a very important one. So what are the preventive measures that everyone should take or follow, especially during this season, to avoid falling sick?
avoid falling sick, or you want to avoid dengue?
Particularly in dengue.
So to avoid dengue, there's nothing, ma'am, except complete. You have to go into war mode, protection against mosquitoes. So basically all the water, stagnant waters which are collecting around your house, and especially if you are really a good philanthropist, go to the school and see if there's any collection of water in some these old tires, tubes. These are the areas where the mosquitoes breed and the larvae form for this so-called Aedes aegypti mosquitoes. They are highly urbanized mosquitoes, this Aedes aegypti. They don't generally go to the jungles. So they breed a lot, especially in any small collections of water. Even an old shoe which was left outside and suddenly there was rain, they can breed in that old shoe. Such a breeding power this Aedes aegypti mosquitoes have. So the basic precautions is, first you have to wipe out mosquitoes in your home, taking all the anti-mosquito preventions, especially these anti-mosquito repellents are there. The strategy, you have to place these repellents very strategically. What the mosquito generally we do is we put this all out or whatever, these repellents inside our bedroom. That's not going to help because the child is going to move around the whole house. So the best way to prevent the mosquitoes from entering the house is, generally the mosquitoes enter from the front door or the back door of the house or the flat, whatever it is. So at those places, if you put the all out, the chance of the mosquitoes coming in will be very, very less. And the most important precautions for dengue is, the child when going to school during the monsoon months must wear very thick cotton socks. The thickness of the socks, if it is above 2 millimeters, then the chance of, because normally the mosquito bites are on the feet, because the child, they'll be, especially boys and girls also, they'll be wearing skirts or shorts. So a part of their legs are exposed. So if they wear long, thick socks, the chance of the mosquito bite will live, because so-called proboscis is the stinging part of the mosquito. The length of the proboscis is 2 millimeters. So if the socks is anything above 1.5 millimeter, even if the mosquito bites the socks, the chance of the child getting injected with the viruses will be almost less. That's all we have to this thing, and of course a good prayer to God.
So anything about the mosquito repellent cream, sir? Is it safe for all the children to apply?
They are mosquito repellents. I would not say they are very safe, ma'am. For example, you want to use an all-out in a room where the baby is sleeping. Don't keep the all-out just beside where the baby is sleeping, probably on the other side of the room. Because the fumes which come out, there is no long-term studies whether they could be having any, because all these fumes, which is really so harmful for the mosquito, anyway, it should cause some amount of harm to the human body as well. But if the mosquitoes are more, if they're saying, a lot of us, what we do is, this Baygon or some sprays are available now. So you spray the room, then in full blown fan, you keep it for about 2 or 3 hours, and hoping that the smell goes on, and after that you come into the room. That's completely zero safe. But that also on the long run, especially if the child has got any allergies like asthma or sinusitis or any rhinitis, these children, it can aggravate the primary allergies because of that smell of that Baygon spray. Other than that, you have to weigh between how bad is mosquito repellent and this thing. And about one more thing about this, nowadays there are some things like odomus, which the smell, it repels the mosquitoes. Some of us apply it, especially when we go on holidays and all that. That also, some children, they have severe allergies on the skin if used. So you have to, if there's any allergy on the skin, then you have to avoid it.
Anything, Dr. Srikanth, you want to add before ending this session?
Yeah, basically just about prevention, like malathion sprays are actually considered as the primary way to like repel mosquitoes. So around the lawn and probably near your front doors, you just have to spray malathion. And nowadays a new larvicidal fish is called gambusia. So any place where there are actually stagnant water, you just get it in a jar of like the fish seeds. So you just like put it inside that and they hatch and they start eating the larvae. And again, as like sir told, like you just have to wear full sleeve shirts and you have to make sure that you're like not bitten, because prevention is like better than cure. And the only way that you're going to get dengue is through mosquitoes. So the only way that you're going to stay safe is by not getting bitten. That's it.
So thank you, doctors, for this informative webinar session. It was wonderful having you all.
Thanks.
So thank you all for joining, and do join us for the next week as well. Thank you.